What's up, guys? This is my second YouTube video, and the topic today is puberty blockers, like the short-term effects, the long-term effects, how they actually affect a transgender adolescent. You might wonder why a child would need puberty blockers, and the first and probably the biggest reason is body dysmorphia. When a transgender adolescent does not get the correct treatment for body dysmorphia, it can unfortunately result with the child risking their life or hurting themselves. Puberty blockers are also known as GnR8, and it does not matter your age, they will allow you to take puberty blockers to help mentally, especially as a child. Puberty blockers help trans adolescents transition comfortably, and where they're not having to rush their decision at 12 years old. Pediatric endocrinologist Dr. Richard says that it is very important that the patient and the family are informed of all of this before transitioning. I always like to start out positive, so for the second subject, we're going to talk about the pros of a transgender adolescent being able to take puberty blockers, helping delay their puberty. But doctors say that the mental outweighs the physical risk that it poses. Kind of just like antidepressants and any other medication, birth control, everything has side effects. I'm not saying these side effects are completely safe, but what is? Obviously, since dysmorphia can cause depression and anxiety, that's going to be reduced with puberty blockers because it will start to delay and they won't develop those secondary sex characteristics because it's unwanted. Allowing a transgender adolescent to take puberty blockers could also improve their social activities and interaction, while also improving the integration with other kids. Because once they can start to accept themselves and have time to think on what they actually want, then they can actually worry about going to school and making friends. Because until then, the only thing that they can ever think about is their body and the body dysmorphia. When a transgender adolescent takes puberty blockers, it gives them way more time to explore their gender identity, because they may not want to transition whenever they turn 18 and they've been through the therapy and they've had the puberty blockers. They could decide, I'm glad I didn't get that surgery because it's not what I want now. And that's what puberty blockers are for, to give them that time to decide what they want. If you're not giving them time, then they're gonna have to make a decision on when they want to fully transition into another gender at 12, 13, like whatever age. They administer puberty blockers at any age. If those secondary sex characteristics have already started and then you begin to take the puberty blockers cannot reverse what your body has already started, but it can delay it from there. So basically, the sooner the better. This is where we're going to get into more of the physical effects, and right now we're going to talk about the short term, which isn't anything too serious, such as headache, changes in weight or breast, changes in mood. And then there are patients who puberty blockers do not fully suppress their period. So those patients could experience spotting or irregular period, long-term effects, which they are not well known, but here's what they do know. There are plenty of different opinions. RHC and NHS is in the UK believe totally opposite. Under RCH, clinic director Dr. Michael Telfer said puberty blockers are reversible. Quote, puberty blockers are reversible. The only risk is that it can affect your bone density. Quote. So the NHS and the UK believe that puberty blockers are not reversible. They did used to believe this, but as of now, they no longer claim puberty blockers as reversible. Whenever you are prescribed puberty blockers, doctors give you a treatment plan. They will prescribe you vitamin D as well as calcium. calcium for the bone density. They will also prescribe exercise or suggest that you exercise. Doctors do have knowledge on adult women and men for puberty blockers and how it affects them. So women can have endometriosis, and usually they will report menopausal symptoms while taking puberty blockers. The symptoms of menopause include hot flashes, night sweats, mood changes, and weight changes. Men who have prostate cancer and decide to take puberty blockers suffer from risk of metabolic syndrome, depression, and cognitive impairment. This is something that I had no clue about and I had never heard of, but puberty blockers can eventually cause chronic pain. Some of the symptoms are headaches, fatigue, insomnia, muscle aches. Weight change isn't like a chronic pain, but it's a part of it. Change in your breast tissue as well. As for cognitive problems, it is very unknown. They do know that although this is helping the patient mentally, they don't know how it is going to affect them long-term cognitively, but they are doing research, but it obviously takes years to get results. So although this is helping the patient, it is affecting their brain development. Another result of using puberty blockers, delayed growth plate closure. It causes you to be taller than most adults. Puberty blockers can affect your body in a lot of different ways. It could increase body fat, decrease your lean body mass, depression, alter your mood. So for the lower bone density, this is where the US and the UK were complete opposite opinions. US thinks that the only risk of taking puberty blockers is that your bone density will be affected. Well, here are the effects of bone density. If it's taken for a long period of time. So people who use puberty blockers usually show significantly less bone density than the average person. And then low bone density causes stunted height, and that increases your risk for osteoporosis, as well as fracturing your bones as an adult. And while you're having treatment of puberty blockers, that is something that your doctor should. It says that they do keep a close eye and they monitor very closely the bone density of the patient. Earlier when I was talking about what knowledge they do have of adults who take puberty blocker, endometriosis and prostate cancer for men and women, Bernard Lane, who participated in a comprehensive investigative article. Something I did not know about puberty blockers is that they actually give this to pedophiles and sex offenders to reduce their sex drive. So obviously this is showing you that there are a lot of different uses for puberty blockers. It's not just transgender adolescents. It's the woman who has endometriosis. It's the man who has prostate cancer. It's the sex offender getting something that should help him, her. Another large symptom is called arterial hypertension. There are measures to prevent this. This is based around your blood pressure, and patients are monitored very closely before, during, and after the entire time. And I have some information for you about some transgender women and transgender men. So transgender women have lower blood pressure within 2 to 4 months of taking puberty blockers, and transgender men have higher blood pressure within the first 2 to 4 months of taking puberty blockers, researchers. And even though there is a way to avoid arterial hypertension, transgender and gender diverse people have a higher chance of getting arterial hypertension. Here's a large part that everyone is so worried about: sterilization and their genitals. But let's get into it with the sterilizations. That taking puberty blockers alone should not cause any difference in you being able to have a baby. Now, if you decide to take estrogen and puberty blockers or testosterone and puberty blockers, it is going to affect your ability to have a baby. If you produce eggs, taking the hormone called testosterone can affect the ability to actually produce them. And if you produce sperm, taking estrogen will affect the ability to produce. Taking puberty blockers does give less genital tissue development. This may limit options for gender-affirming surgery or the bottom surgery. For 25 years now, puberty blockers have been prescribed, and researchers still don't know how puberty blockers actually affect hypertension and blood pressure over time. Previous research back in 2016 had shown all these statistics about transgender women and transgender men having heart attack more than the regular person. But 4 years later, in 2020, researchers obviously found that the sample sizes were too small to detect anything statistically significant, especially with the differences in blood pressure. I just want to thank you guys for watching my second YouTube video. I'm gonna be posting my references. Last video, I made it for children somehow. That's why I couldn't post the link. All my references are gonna be posted. I'm gonna get off here so I can edit this video.